We're very lucky today to have Elizabeth Weir, who's a doctoral scientist at the Autism Research Centre at Cambridge University.
Yeah, thanks so much. As Joyce mentioned, my PhD is focused on the physical health of autistic adults and looking at kind of what sorts of factors are leading to the increased health burden that we see. So as you may know, unfortunately, a lot of research is now suggesting that autistic individuals might be more likely than other people to have both physical and mental health conditions. So what I did was I tried to develop this survey in order to better understand how this is affecting adults across the lifespan. So starting from adolescence, about age 16, all the way up through older adulthood to age 90. And this is really one of the first studies that looks at individuals across middle age and older age. So we created this online survey that asked about a number of things, including medical history, but also asked about things like diet, exercise, and sleep, because we were really interested in better understanding the experiences of autistic adults in these areas, but also understanding how diet, exercise, and sleep might feed into these sorts of physical health risks, particularly for conditions like heart conditions like high blood pressure and heart disease, but also diabetes and prediabetes as well. So we administered this survey via Qualtrics to just under 2,400 people. About half of them were autistic, half non-autistic, and there was an average age of about 41. So as I said, really looking at across the lifespan from adolescence all the way through to older adulthood. And if you're interested in looking more about the kind of maths of it all, you can certainly read the paper. It's available open access, but I won't go into all of that today. I'll basically just hit you with kind of the results that we found, which are that autistic adults, and particularly autistic females, are more likely to exhibit kind of unhealthy diet, exercise, and sleep patterns. This is things like they're far less likely to sleep at least 6 hours a night. They're far more likely to have sleep disturbances, particularly things like narcolepsy and sleep apnea, as well as night terrors, things like that. And they were more likely to have dietary restrictions as well. And they were less likely to exercise. So less likely to exercise at least 75 minutes per week, and less likely to report exercising at least once per week as well. We also looked at things like BMI, and we found, much in line with all the other literature, that autistic individuals were more likely to be underweight than non-autistic individuals, and they were also more likely to be obese. We then wanted to look at whether or not these kinds of diet, exercise, and sleep patterns were affecting health risks. So we used some complex modeling to look at that, and unfortunately we found that among autistic males, even more than when we look at something like family history of a heart condition, we found that these lifestyle factors are really contributing a significant amount of risk. So the study isn't causative. We don't know for sure that this is causing heart conditions. I should really say that. But we do know that there's a strong correlation between unhealthy life patterns and these kind of heart outcomes for autistic males in particular. Now, this is the first study that's really looked at that, but we do know that there are patterns of unhealthy diet, exercise, and sleep that we see all the way from childhood. So really what this study is doing is filling in this gap, saying we know that this is happening in childhood, and actually these same patterns are persisting over time across the lifespan. The other thing to keep in mind, though, is that this particular study might not be representative of all autistic people. It particularly focused, or it mostly included people who were intellectually and physically able to fill in an online survey. We had an overrepresentation of white individuals, of autistic females, and also of those with at least a high school education or higher. So that's certainly not the entire autistic population, and there might be differences that we see if we look elsewhere, but this is still a large study that gives us a real idea about what kind of the experiences of autistic people might be and how this might relate to health risks.
Do you have any suggestions for clinicians on what to do with the data?
Yeah, I think, just like anything, and I'm sure clinicians are very, very aware of this, it's a complicated picture, right? Because we think about these kind of lifestyle habits, diet, exercise, and sleep, they're so integral to so many other parts of your life, right? And I think I would be remiss not to mention, health education, things like that, trying to provide autistic people with sort of strategies for how to do this. But I think also having conversations about why are you struggling with diet, exercise, and sleep, right? Because I think that's something that this questionnaire can't answer, and really research that needs to be done is looking into what are the challenges, what are the reasons, is it that you're struggling with your mental health and it's just making everything harder to manage. It's hard to maintain things like exercise and sleep and diet when you're dealing with that. I know certainly on social media, and this isn't, going to be representative, but a lot of autistic people have commented on the study talking about camouflaging and talking about how the exhaustion that comes with camouflaging makes it really, really hard to manage in other areas. So it's a multifaceted issue. And I think talking with patients and saying, what can we do to help? How can we try and intervene? Because we know that these unhealthy patterns can really affect health outcomes, but also, it can affect education, it can affect employment, it can affect so many areas of life, and can if you're struggling to maintain those things, those lifestyle behaviors, it can really, have a sometimes negative effect on so many other areas. So yeah, I think trying to educate people, but more just listening to what your patients are struggling with, and trying to have really open, honest conversations, and then trying to come up with, specific interventions. And I'm sure clinicians that work with autistic patients regularly know every autistic person is different. Every person's going to have different challenges. Also, I think particularly with the dietary restrictions, a lot of that might be because they have gastrointestinal issues. It might be that, somebody has celiac and has to be gluten-free, and there's just no way to avoid that. And that's not a problem necessarily, but it might make it then harder to meal prep, or harder to create, space for specific, taking into account all other areas of diet that need. I know certainly my friends and family that have dietary restrictions, it can pose a huge challenge. So I think, it's not really it shouldn't be something that is like a point of blame or anything like that, but it's just trying to meet someone where they are and say, what can we do? How can we help?
Yeah, considering there's probably restrictions already based on someone's sensory sensitivities, and then on top of it, there might be medical reasons as well to restrict someone's diet. Say our speechies who do mealtime assessments, that's something to bear in mind in terms of maybe the impacts of restricted diets and the flow-on effects of that as well. Because we know that can affect, as you said, weight, whether people get overweight or underweight from maybe a very restricted diet, or maybe too much of a calorie intake. For our behavior support people, maybe looking more at the factors that can be barriers to be able to exercise regularly and sleep have good quality sleep, and doing a more thorough assessment of the sleep, I think, is really important as well. We do ask a few questions within our basic assessment, but going into like your survey, you've mentioned narcolepsy, and there's particular sleeping disorders that probably are more prevalent, and I didn't think about night terrors as an issue, but that's something to bear in mind as well. Just thinking for our exercise physiologists who do exercise plans for our clients who are autistic, to really incorporate that in their routine. But when routine does get messed up because of COVID, whether there's ways we can add in that flexibility, so there's a plan B for people and things they can do within the home to keep that exercise up. I'm sure I can do with some help with that too.
Yeah, me too.
Yeah.
I'd love to hear more.
Okay, thank you so much, Elizabeth. It's been great talking to you. And please share your findings of your next study with us too.
Definitely. And if people want to follow me on Twitter, I also usually post my my results on there. It's eweir, WEIR 21. So follow me on Twitter. And I'm so grateful for all of the wonderful work that clinicians are doing as well with patients in order to really support autistic people. I think it's great. So.